Hello, thank you very much for having me today. My name is Dr. Rasha, and I'm very happy to present this important session today about the role of the AI in early patient screening and risk stratification in antimicrobial stewardship and resistance. My presentation today is focused on the AI and the early screening. Why AI is important and why early screening is important. I will first start by the challenge. We have a big challenge which is antimicrobial resistance as one of the top 10 global health threats. As we know from the last WHO report this year, that in every one in six infections is antibiotic resistance, and by the global number of this, which is in the last report, 1.2 million deaths by year due to the antimicrobial resistance, which make this resistance is really one of the most global threat. For this reason, the antimicrobial stewardship is one of the practical solutions that provide strategies to improve antibiotic use, enhance the patient outcome, and have important part in reducing resistance. So, what is the role of early screening with regard to the antimicrobial stewardship and AI? This is the main aim of my presentation today. In early screening, we need to ensure early detection for any high-risk patient before symptoms become worse, to be able to make risk stratification and predict any infection or resistance pattern, to to provide like targeted therapy to enable the time and the appropriate and the evidence-based antibiotic prescribing and decision making. The role of AI in early screening is very important to maintain the continuous monitoring, predictive analysis, and real-time decision support to our electronic health report. So, to bridge the AI with antimicrobial stewardship in clinical practice, the AI technology is very important to cutting the edge, to provide predictive analysis, and to provide real-world monitoring. All of this will enhance our practice and infection management, antimicrobial stewardship practices and implementation, promote patient outcome, and improve patient safety. So, the main focus of my session today is to foster collaboration among healthcare professionals and AI technology, accelerate the AI innovation and implementation with regard to the infection management and the antibiotic stewardship implementation, and bridge this gap from innovation to antimicrobial stewardship implementation or effective practice, which has certainly impact on antibiotic resistance. With regard to the AI across different infectious disease practice, early patient screening and risk stratification build important predictive model, which is important to make importance in early screening. The AI also could be used in surveillance after antibiotic prescribed, which is help in monitoring, and also could help in diagnosis and in drug discovery and in implementation practice in antibiotic stewardship practice. And AI for sure need like governance and ethics, like we will discuss today later in my slides. But what I would like to say that the patient practice and the patient care is a streamlined process, starting from early screening, diagnosis, and prescribing antibiotic and then monitoring. So using or integrating AI all over these stages of antibiotic use have a great impact on patient outcome. Now, I would like to speak mainly about how AI best use in patient screening, risk stratification, and predictive analysis. The first issue is infection risk prediction. Using the AI in early screening can help in predicting any infection risk, which will help in continuous monitoring in the electronic health record, and also could be used to provide early warning alert for any infection before it becomes severe. In addition, the resistance risk assessment, With regard to the multi-drug resistant organism, which we are seeing this in mainly in more of the clinical practice, AI use has very important impact on this. And also with regard to the patient-specific factors or symptoms from the patient, AI could be able to help to detect these symptoms and make like a stratification for the patient if the patient is severe or mild or moderate risk, and could be able to put like a recommendation based on the local guideline. And finally, AI could be help in clinical decision support system to optimize the empirical antibiotic therapy, to provide real-time recommendation and the evidence-based practice, which is very important to integrate it with local guideline and also global AMR policy, as we will discuss later in this slide. So using the AI effectively could have an integrated role in effective and promote the use of antimicrobial stewardship and early screening of the patient. Now I will go to the global guidelines, like as samples, not examples of the global antibiotic stewardship practices. I will start with the WHO aware criteria and then the UKHSA National Start Smart Then Focus, which is guideline for antimicrobial stewardship for clinical algorithm or clinical management of the patient. And finally, the guideline which I have the honor to develop this one, which is in South Center Guide Framework for Antibiotic Stewardship Practices for Prescriber and the Clinician. The first one is the AWARE guideline or the AWARE classification from the WHO. As WHO make like three important classification for all antibiotics. These classification need to be all prescriber or all clinician or all practitioner need to aware about this classification. This is the access group, which is the first line that could be used by safely. Although we have also the watch group, which need watchful to the antibiotic use to ensure the antibiotic is used properly. And finally, the reserved antibiotic, which is reserved for the patient who need to take this antibiotic with severe condition. With this classification, we would be able to understand how the antibiotic should be used and also with regard to the local guideline for any disease according to the patient diagnosis. The second one is the national guideline here in the UK, which is UKHSA Start Smart Then Focus. This one of the very gold standard to maintain and arrange the antibiotic prescribing, start from early screening or initial antibiotic use using Start Smart criteria by assessing the evidence of infection and make assess, investigate, prescribe, and document, and then focus criteria, which is the decision of antibiotic after reviewing the course after 48 or 72 hours, and what is the decision that could be taken with regard to antimicrobial stewardship, either to stop antibiotic or cease or amend, de-escalation, go to the narrow spectrum antibiotic or broad spectrum antibiotic, or refer for consultation for ID consultant or microbiology, or extend or continue or switch antibiotic, like the example from the IV to oral switch. The third one, which I'm delighted to develop this framework, as I'm a global consultant for antimicrobial resistance in Switzerland in South Center, which is supervising 55 countries of the low and the middle income countries, I was delighted to develop this framework for antibiotic prescribing together between the WHO aware classification and the UKHSA Start Smart Then Focus. It includes 5 important steps that each prescriber or each clinician need to know, all of these 5 steps when using antibiotic with any clinical infection patient, starting from gather the evidence and assess the patient risk and if the patient has a sign for bacterial infection or not. The second one is urgency assessment and identify the source of infection to act fast if the patient has sepsis or severe condition. The third one is to identify the choice and able to be to take the decision of selecting the right antibiotic with regard to the local guideline and the aware criteria and the national one, which is UKHSA, Start Smart in Focus, and then duration planning according to the patient condition and according to the local guideline, the diagnosis of infection, then it should be able to define the duration. And finally, the most important step, which is evaluate and review, to review the patient medication and take the proper decision after this evaluation if the antibiotic could be stopped or discontinue, or what is the best action for this antibiotic. I'm delighted to introduce this guide framework, which help to maintain the evidence-based antibiotic prescriber. Now, back to our presentation and our session today, how the AI could be used in early screening with regard to all of these guidelines and policy of antibiotic stewardship and antibiotic prescribing, and how this could help to mitigate or confront the antimicrobial resistance. As I mentioned earlier, we have three important milestones for the use of the AI. The first one is early patient screening by identifying the infection risk and make the like risk prediction, take the proper decision, maintain one of the most important issue, which is sepsis early warning. As we see, a lot of sepsis patients died in the hospital. And based on my clinical background as a pharmacist, clinical pharmacist, I have a lot of situation with patients that really, the hour will help to, or starting the broad spectrum antibiotic early could help to protect patient life. So this is one of the most important use that could AI could help. The second one is risk stratification with regard to the multi-drug resistant bacteria or organism. With regard to the local epidemiology, we can help too with antibiogram and antibiotic measurement and the bacteria percentage of multi-drug resistant bacteria in the hospital. We could be able to update the local guideline with regard to the local pattern, and the AI could suggest or advise which is the antibiotic could be used. And finally, the predictive analysis. As we know, what we could not measure, we could not improve. So the AI would provide like a very important tool to measure how antibiotic is used, and then would be able to provide a predictive recommendation and predictive optimization with regard to the patient as per patient or cumulative as per ward or clinical ward, or by hospital, or by benchmarking by months. This predictive analysis could help to promote the use of antimicrobial stewardship, maintain dose optimization, maintain the de-escalation timing, and the most important one is resistant forecasting, which is very important in proactive stewardship and resilient stewardship. Let's go for the evidence. I'm delighted to introduce my studies with regard to my research project, which is retrospective study investigating the antimicrobial stewardship in two hospitals or NH trusts here in the UK, and it has been published with regard in Frontier and also another one published in MDBI and these study and PMC Public Health. These studies, all of these studies or in my study, I using the WHO classification as benchmarking and the UKHSA also as benchmarking and make my study. And based on this outcome, I was delighted to promote or provide like a digital dashboard for antibiotic prescribing. I put the link by the end of my presentation if you would like to take further detail about this. But what I would like to say, providing smart antibiotic stewardship practices supported with digital dashboard will help to improve the antibiotic stewardship on patient level or organizational or service level. This will help to make consistent or resilient or sustainability of antibiotic stewardship practice with regard to early screening of the patient at time of admission to healthcare setting, and could be able to use or integrate the AI to help with the decision support. So, with regard, as I mentioned, in predicting the sepsis and if any deterioration happen with regard to the patient in vital signs of the patient and lab results in electronic health record, detect any infection indicators, and there could be like clustering or the high risk infection, and the guides antimicrobial stewardship review or like recommendation on the system to review this antibiotic. And the most important issue is detecting any incident and ensure the practical action could be it is taken properly to prevent the recurrence of this infection and promote the patient safety. This is one of the most important or core use of the AI in early screening. So, if we speak about the early screening and risk stratification, the AI could support in three important elements. The infection risk prediction, as per the clinical indication of the patient, the vital signs, if there is any previous lab available, and the comorbidities, the sepsis detection, which is very important to maintain the broad spectrum antibiotic is taken on the right time, the resistant risk assessment. The second part is predictive analysis or for the antibiotic prescribing in order to optimize antibiotic use and maintain dose optimization and the de-escalation recommendation. The third part is to promote or provide the real-time clinical decision system, support system, and maintain the consumption pattern analysis and resistant forecasting. To summarize, as per three guideline, I mentioned the WARE guideline, the Start Smart, the guide framework, the AI could be integrated with the system, a hospital information system, and also supporting these three guidelines, which is very important to sustain the antibiotic stewardship practices. Now I will go to the key benefit from the AI, which is clinical impact and the stewardship impact. Clinical impact with regard to the improve the clinical infection detection and more accurate detection of infection. And the second one, which is antibiotic stewardship impact to provide scalable interventions of antibiotic stewardship, resistance surveillance, and real-time data analysis. I will go now to the importance because of the time. I will go now to this case scenario or case presentation I provide to show how the AI could be used in early screening. Starting from this patient presentation as example of our patient, 68 years old, community-acquired pneumonia, started with IV piperacillin tazobactam, which is in watch criteria with the WHO aware criteria. In day 3, the patient is clinically stable and the febrile and the blood and the sputum culture is negative. When we talk about the AI, how it's used, this is the recommendation could be shown from the AI. Once patient is stable and the culture negative, should oral route should be established. So the AI would put the recommendation as per evidence-based recommendation as per local guideline to switch the IV to oral antibiotic or access antibiotic and de-escalate the antibiotic and to continue for 5 days as per community acquired pneumonia guideline. In this situation, clinical team should review the AI recommendation and ensure taking the corrective action, the switching the antibiotic. And this is the outcome of the AI achieved: shorten the hospital stay of the patient, reduce broad spectrum antibiotic, access antibiotic which is target, and it could be tracked after this by the KPIs or key performance indicator. So the learning point, the AI should be used, give advice, give like pop-up or give a recommendation, but we need to access this recommendation and approve it first. The key learning point is you AI need to be used smart. When comparing between the traditional and the AI, we will find that the AI could increase the compliance with the antibiotic review, 40% reduction in broad spectrum antibiotic, and improve the use of antibiotic within aware targeted. So when we see at the time of the admission, AI can take the patient history or the patient symptoms and the indication and make monitoring to the antibiotic use, improve the antibiotic, then can give alert on the system how by recommendation. And then the most important issue is to review AI recommendation and agree this. This one of the most concern I would like to focus before end of my presentation today is about ethics. We need to maintain the ethical use of the AI, the reproducibility of the use of the AI, how reliable, how valid. This is very important. We can use it as a tool to help us as a guide and support antibiotic prescribing, but we need to ensure that AI is used ethically, and we need to have a lot of training on the AI use before we integrate this in the system. So, to end up my presentation today, I'd like to focus on some important issue. AI could be used, and it's promising to be used with antibiotic stewardship and an early screening of the patient to adapt a transparent and explainable model of the AI to measure the real world outcome to sustain clinical and policy impact. It's important to make prioritization for the high impact scenario and share the success lessons from this, and engage clinician and validate the data and maintain equity and continuous learning and sharing the best practice. This is the end of my presentation, and here is the resources of my studies, and the last one, including my research profile, which including all my study and all my presentation. Highly recommend if you want to know more about the antimicrobial stewardship practices. Thank you very much for listening, and I'm delighted to be with you today, and I'm happy for any discussion or any question. Thank you.